from 9 a.m. until 4 p.m. I've got a group of young people here in the studios, and Mr. Davelaar, you can include yourself as part of those young people too. Okay? Mr. Davelaar is the head of the Collective Prevention Services of the Public Health Department. Is that correct?
No,
no, I said it all wrong after we took all that information. Oh my gosh, I'm ashamed.
I'm the project coordinator.
Project coordinator. I thought you said, man. Okay, project coordinator. Okay, my bad. I'm sorry. Oh gosh, I'm giving you a title like you're not even being paid for.
It's okay.
Okay, Mr. Davelaar, tell us about you being the project coordinator of CPS. That's correct?
Yes, I'm a project coordinator with the vector control at CPS.
Okay.
So that's a section of the collective prevention service that deals with mosquitoes and also rodents, and we try to control them on the island of St. Maarten.
Has that been successful?
Well, up to now we are trying our best, but we want the community of St. Maarten also to give us a hand when doing this part of elimination of breeding sites.
Okay.
So last year we did a pilot, and we did it in the cul-de-sac area, but the result was astonishing that we found a lot of houses infested with mosquito larvae.
Why was that? Why is that exactly in that particular area?
We started in that area because due to mosquito complaints and also the amount of Zika cases, it was concentrated in that area, and that's why we did a pilot.
Okay. You're saying we, and you were joined by whom?
In that day, we did a pilot. We was using volunteers. We call in a lot of volunteers from Red Cross, medical students also, and we gave them a short training on how to identify the mosquito larvae. And we went out in the weekends during a Saturday for about a month and a half, and inspect about 600 houses.
Oh wow! Okay, 600 houses. So how do you measure the severity of the mosquitoes? How do you measure that?
You compare the total amount of houses that you inspect and the total amount of houses infested. And you get a house index. And when you compare with the WHO threshold, we found 21% at that time, and the World Health Organization threshold is 2%. So that's, you can measure the importance of the high incidence rate.
Okay. Now, Zika cases, we haven't been hearing much about Zika cases. Is that kind of like we don't have a problem with that here on the island anymore?
Not really. We're not having it. It's under
control? It's under
because
control?
of the rain, it stopped raining, and you don't have so much breeding. But there are artifacts that are still out there. So as soon as the rain season starts again, you will get collection of water again, and the mosquito will start developing again.
So what are you doing to actually educate people about the prevention of, standing water in their areas and stuff like that? Also joining me this morning from the I have 3 medical students actually. They are Andrea, Becca, and Constantine. Any one of you want to talk about this, or you, Mr. Davelaar, you want to pass the mic? No, you take that. And you have him take this.
Sure.
There you go. All right. There you go. All right, Constantine, how you doing?
Good. How are you? Thanks for having me.
I'm good. Okay, so tell us about that.
So, like we said, we've been working with CPS for about 7 or 8 months, and we call ourselves the Z-Pack. So we're a Zika prevention initiative run by medical students. We've done a lot of research and a lot of work within the community, educating and reaching out to people about prevention, getting rid of standing water. We actually do a lot of analysis on the cases that we've seen on the island in the last year. The CDC calls St. Maarten a level 2 place out of 3, so it could affect things like travel and tourism.
Wow.
So we really want to talk to people about Zika and other mosquito viruses like dengue, chikungunya, how to prevent them, how to get rid of mosquitoes, and it's really built upon our partnerships with people like CPS, Red Cross, community centers.
You make house calls, go from door to door.
So instead of house calls that the CPS will do with inspections, we actually do some meetings in the community, like group meetings. We've done Healthy Me Fair with the 7 Adventist Day churches. We've done some meetings with the Islamic Center and some other places around the community where we kind of talk to a group of people, address some questions, and talk about cleanup and prevention.
What are some of the questions that they're asking where they can prevent the breeding of mosquitoes in their surroundings?
Yeah, some people are surprised to hear that the best and I guess cheapest way to get rid of mosquitoes is to just get rid of water instead of buying repellents and things like that.
Yeah.
Other questions focus on things like microcephaly that people have heard from pregnant women.
Yeah.
In St. Martin, both French and Dutch side, there's been 50 cases in the last year. So
of microcephaly?
Of reported pregnant women.
Pregnant women? Really?
Yes.
And that has been kept so under wraps.
There's only one case on the French side that was ever reported of any complications.
So why are they doing that actually? Why have they kept it such a, it's such a secret? Nobody talks about it.
So infectious diseases and public health departments like the CDC and local ones have a hard time collecting the data on real cases versus reported cases.
Reported cases, exactly.
People are also very, very used to having mosquitoes around, having dengue and chikungunya, yellow fever, so this doesn't pose that much of a threat to them up front.
So they become sort of like family members, the mosquitoes, like open the door, let them in.
Very annoying family.
Yes. Oh my gosh, I get real paranoid when I see a mosquito in my house.
Me too.
For real, honestly, and I have like cans and cans of Baygon in the house. I just see when I start flitting all over the place. Yeah, wow. Now, so let's get back to microcephaly now, because I'm very disturbed. You think it was sort of like kept hush hush because they didn't want to cause an alarm, or anybody didn't want to cause a panic on the island?
I think anytime a public health department encounters a disease that's growing or spreading in number, it's difficult to educate the public on what's going on without having all the facts first. So we know that this stuff started in Brazil. We know that it moved all the way up to the United States and Puerto Rico and around the Caribbean as well. But it's hard to kind of get the real numbers when people may not go get tested. And that's what is so important about the Lions Fair Club tomorrow. It's an opportunity to go get tested and have actual numbers.
Oh, okay. You're testing tomorrow? When you say testing, what kind of tests are being carried out?
We organize also together with SLS to do the Zika testing. They're going to take 2 blood samples.
That's tomorrow. You're going to do that also? Really?
At the Fair, in order to see if in the past you got the Zika virus.
Wow. Okay. When you say in the past, meaning that if you had it.
If you had it, it can still be
in your system?
In your system, so that
really?
Through the blood test, they can find out if you really had it. Not only Zika, but also dengue or chikungunya if you have.
So it doesn't leave the body?
It doesn't leave, but it doesn't give you the symptoms anymore. That's why a while ago you was telling us about why they kept it's not a secret. Indeed, we got about more or less 50 pregnant women, right? But not that any of those pregnant women got any baby that has the microcephaly.
Oh, okay, that were infected to the extreme of having a
exactly.
Oh, okay. All right, so let me say hi, good morning to Becca. Becca, how you doing?
I'm doing well. Thank you for having us today.
You have along with Andrea, have been working with the CPS you mentioned for the past 7 months. And what has been happening during the course of working with the company? What have you all been doing?
Okay, so we've been very privileged to have our partnership with the ministry. We've worked to establish more community partnerships. We'd really like to interact with the community.
Did you all volunteer for this, or you were called upon?
We're medical students, and we created kind of our own little coalition at school. And through our school contacts, we were able to get in contact with CPS and develop this partnership. We want to develop more partnerships. Our biggest goal is to get the news out there and get Zika information out to the public so they know to go get tested and they know the best way to prevent Zika. So we've been honored to be welcomed at the Seventh-day Adventist Healthy Me Fair. We've been to a few schools.
Like Constantine was saying a while ago, yeah.
And we're actually going on Sunday to the mosque to give a presentation at to the Muslim community about how the best way to decrease your chances of getting Zika are. And as Mr. Davelaar and Constantine have said, the best way to do that is to clear out your water. So we're very interested in developing more partnerships, getting into the churches to hold kind of town hall meetings where we can hear from the public what their concerns are, but also give our information and what the best way to prevent this is.
All right, Andrea, do people really know what Zika is? What are some of the symptoms?
Actually, surprisingly, more people know about it than we expected. We get most of the communication that we've had, they've been very receptive, and they know what it is. And because mosquitoes are so present on the island, there's not really a fear so much of getting it because so many people are asymptomatic. They don't have symptoms. They don't present all the time. So it's kind of an ongoing thing, but I think the majority of the community knows what it is. They just don't know the extent of the effect.
Right. So you get stung by a mosquito. What's next? I mean, and what kind of mosquitoes do we actually have here on the island? Did you all do a survey on that? What kind of mosquitoes do we have here?
Basically, in the Caribbean, you have the Aedes aegypti mosquito.
Okay,
that
right.
Is the mosquito that transmits the yellow fever,
right.
the dengue, the chikungunya. It's the same mosquito. But this year, we're going to set out some traps in order to really identify what other types of mosquito we have on the island, in order to be prepared in case any virus will show up.
Okay, all right. Now, you all got some information that you'd like to share with the radio listeners this morning, I assume, that which you also will be sharing at the fair tomorrow, too. So who's going to take the floor on that? You, Andrea, or Becca, or Constantine?
Yeah, sure.
Who wants to take that?
Sure. So we put together a few interesting facts for people to understand. We're going to hand these out at the fair, at the other events that we do. Zika has been around for almost 70 years, surprisingly. It started in Africa. It's nothing new. Yeah, it's a long existing virus, and thousands of people have actually been infected since the outbreak 2 years ago. But like you were talking with Andrea, that only 20% of people present with symptoms, the rash, the headaches, the pains. And most people think it's chikungunya or dengue or yellow or fever or something. Their cases are actually on the rise. The connection to those pregnant women and congenital deformities is kind of not fully understood yet, but we're watching it in the field of medicine. St. Maarten is very, very close to the middle of the outbreak. And the most important thing we want to teach people is to reduce the number of mosquitoes. And the best way to do that is by getting rid of standing water, like Rebecca said. So we hope to kind of address people's concerns, answer some questions, and as we meet with more and more communities within St. Maarten, we hope to really hammer down that getting rid of standing water is the best way to get rid of it.
The best way. What about people who own like garages and stuff like that, where you have like a lot of tires and all of that too?
Tires are actually one of the biggest things. So tires, old toilets, toys in the yard, tools, toolboxes, lunch boxes, anything that holds water. There are ways to flip them over or cover them or put them away that they won't collect water, and just knowing that and kind of taking care of that in everybody's yard or home or work or office or garage is really the most effective way.
Why are mosquitoes so attracted to the color black? I always try to figure that out. Do you realize that when you wear black, you get a whole lot of mosquitoes around you?
Fashion sense? I don't know.
Oh my gosh, come on. And they always go in tires, and tires are black, and they always want to go in everything, at everything that is black.
I think they feel safe and
dark.
protected under darkness.
Under darkness,
people say to wear light clothes if you can.
Correct, right. Okay, so you all have you will be at the fair tomorrow from 9 o'clock, right? And you'll be sharing all this information with everyone who visit the booth. Anything that you'll probably, in addition to this, that you'll be sharing with the people who come to the booth tomorrow? Any information? Go ahead, Becca.
Yeah, we'd like to continue to reach out and develop more partnerships. So if anyone from any churches or anything would like to hear from us more, we'd love to meet with them tomorrow and maybe set up a time for us to come to your church or to your place of worship or your community center and meet with you and talk to you about this and gain information from you, because the best way to do this is collaboration. So the more stakeholders we have involved in reducing the mosquito population here, the better, and the more effective we'll be.
Okay, and we are like said code 2, I think, right? Yeah, and that's really bad because so it's from a rating of 1 to what? 1 to 10? 1 to 3. We are at number 2. My gosh, who's at number 1?
Everybody's number 1. It's just usual travel.
Just usually travel.
3 is bad.
Yeah, 3 is really bad. Wow. But 2 is bad enough. Yeah. Okay. Mr. Davelaar, anything else you'd like to share with our radio listeners this morning before I let you guys go?
Okay, tomorrow also at the Lions Fair, we're going to have a mini lab that is actually mosquitoes that we're going to have. You can look at them through the microscope. We're going to have larvae.
Live or dead?
The flying adults are dead, but the larvae, we're going to have some live ones. And we're going to use some guppies for people to see how the guppies can eat the larvae. So if anyone in St. Maarten has a cistern, the best way to get rid of the larvae
I was about to ask
the
you
guppies
that.
in the cistern.
In the cistern.
Because it will leave the cistern free of larvae.
Okay. Yeah, because that's another question I was going to ask you. Seeing that people in St. Maarten, so many people have cisterns here, you're going to teach them also how to prevent the breeding of mosquitoes.
Exactly.
Wow.
Because we're going to show them also if they have a screening net, how to screen the overload fight on the system so that the mosquito cannot go in to lay the eggs.
Oh boy. Oh boy. Wow. A lot of information. Interesting. So, again, to everyone out there, you're invited to the fair tomorrow. It's the Health and Wellness Fair, the Rudy Hoover Health and Wellness Fair, organized by the St. Maarten Lions. And the another guest here on the program this morning is from CPS, Collective Prevention Services, with Mr. Davelaar, along with Andrea, Rebecca, and Constantine. I said Constancia. Constantine. I'm sorry, Constantine. I'm sorry. Who will be there tomorrow to share any information that any questions that you might have. They will be on the spot there to answer those questions. Okay, so again, I want to thank all of you for coming in here this morning. And yeah, I'll probably drop by tomorrow and kind of like get a feel of what's going on, and anything that we probably didn't talk about here, I guess I'll find the information. I'll get the information when I get there tomorrow. Anything else you'd like to say to the radio listeners, ladies, gentlemen?
I would like to say that we are located in booth 8 and 9.
Oh, 8 and 9. Okay, all right. So this is 8 and 9. Booth 8 and 9. Okay, we'll find you. We'll find you. Good. All right. Thank you so very much.
Thank you.
And good luck tomorrow. Okay. And thank you, radio listeners, for listening. And I'll be back after the break. I have to give away. I have a T-shirt to give away, courtesy of Rio Productions. They're having their lighted parade tomorrow, next Saturday.